Northwest Kidney Centers provides more than 200,000 dialysis treatments every year. For the 30% of patients waiting for a transplant, Northwest Kidney Centers guides them through the process and provides support after the surgery. It's all part of our work, sustaining lives and inspiring hope.
Bill and I had a lot of opportunity to work together every week. And Bill began to get sick, and it was noticeable. He didn't look as good. He didn't have energy like he used to, but I didn't know what was going on. And then one day he came into our meeting and we were chatting about it, and he said, I just need to let you know what's going on with my health, and I have this disease. It's called polycystic kidney disease. We said, well, what's the solution? What do you have to do? Well, I'm probably going to have to go on dialysis, but the ultimate solution is a transplant. And so that started the conversation, and I went home and I said to my wife, well, I sure hope you find somebody. So 2 weeks later, I said to Bill, so what do you have to do to be an organ donor, to be a kidney donor? And he said, well, really, it's just blood type is all that matters. And as I pondered that, I thought, I'm type O. And so I thought, well, if he can take my blood, he can probably take my kidney. And so I felt very strongly during the meeting that I should make that offer. And at the end of the meeting, that's what I did, is I said, Bill, well, you can have mine. It was a decision that I made without any hesitation. I knew it was the right thing to do. I felt that immediately, but I really didn't know what I had decided. And I had to go back and figure that out and do some research.
I work at the Northwest Kidney Center, and the focus is on chronic kidney disease program. We work with patients, doctors, and we teach them about chronic kidney disease. It's a disease that affects the kidneys, and it's very common. It's usually slowly progressive and often irreversible. When patients develop kidney failure, then when you have to sustain life, you have to use renal replacement therapy such as dialysis or kidney transplantation to survive. The problem that we're facing is that wait list for the transplant has been growing, and we don't have that many kidneys. And so if you think about it, the only way to increase transplantation is to increase living donation. And so that's where the focus right now is. How could we create this community that is aware of the need and patients who are willing to go and ask for a kidney?
Someone in our church contacted both Bill and I, and his name is Tyler. And Tyler said, can you come over and talk to my wife and I about your experience? I'm interested in finding out, how do I get a donor? I said, Tyler, you just need to tell people. You just need to share this.
I have a pretty strong network of family and friends, so I'm going to do my best to help myself and get that network out there and look for a live donor.
And so Tyler went out and did that, and had a family member, a cousin, who heard the story and was touched and said, I think we can do that.
You have a hard time picturing yourself going up and say, hey, can I have one of your extra kidneys? That is something that you don't really feel comfortable with, but through letting it get out there, people will start coming to you, actually.
So we need to give patients tools. How do they ask for a kidney? How do they share this story? And that's what we teach in here at NKC. Share your story. You never know who is listening.
Northwest Kidney Centers also plays a key part of that support group. And as they come to Northwest Kidney Centers and they say, my doctor says I need to go on dialysis. What are my options? Explain how this works. There's an individual care and a tenderness there that very much impresses me.
The thought of somebody actually being willing to do that, go through that process for me, and to know that my body would get back on a natural process, to be able to feel good and filter things out and just be able to get some energy back and to be able to enjoy my daily life and my family again. So exciting. And the process that I've gone through has enabled me to get my life back.
I think Northwest Kidney Centers benefits our community in amazing ways. Not everybody can give a kidney to somebody. Not everybody can give blood. And there are other ways to support. As the need continues to go up, the number of people that are on the transplant list climbs, the opportunity for all of us to save a life and to have an impact continues to grow.
If there is this community that's aware of the need and willing to donate, and we have these patients who are willing to ask or share their story, then it will work.
It's really exciting to watch people have this experience where they can reach out and tell their story, see the response, the generosity of the response that inevitably comes. It's just, it makes you realize there are a lot of good people out there. You know, it's really neat to live in this world.